Understanding blood color during a miscarriage.
Hello viewers. Today we'll be discussing an important and sensitive topic that may concern many: the color of blood during a miscarriage and what it could potentially indicate. Miscarriage is a common event that happens in about 10 to 20% of known pregnancies. Although it's a difficult subject, understanding the signals our body sends can provide some insights and help us better communicate with our healthcare providers.
What is a miscarriage?
Before we delve into the colors of blood, it's crucial to understand what a miscarriage is. A miscarriage, also known as spontaneous abortion, is the loss of a pregnancy before the 20th week. Most miscarriages occur before the 12th week of pregnancy. It's often characterized by vaginal bleeding, abdominal pain, and cramping.
Colors of blood during a miscarriage.
Now let's talk about the color of blood during a miscarriage. Typically, it can range from light pink to bright red to dark brown. The color variation largely depends on how long the blood has been in the uterus. Light pink or brown blood is usually older and has been in the uterus for a longer time. It may not be a sign of miscarriage on its own, especially if it's not accompanied by other symptoms. It can be related to light spotting, which sometimes occurs in a normal pregnancy. Bright red blood is fresh and can be a sign of active bleeding. If you notice a flow of bright red blood, similar to your menstrual period or heavier, and especially if it is accompanied by cramping or pain, it could be a sign of a miscarriage. Dark brown blood often represents blood that has been in the uterus for a longer time. It can sometimes be seen after a miscarriage has occurred, and the uterus is expelling leftover tissue. It's important to note, however, that spotting or bleeding during pregnancy doesn't always mean a miscarriage is happening. But it's always a good idea to consult your healthcare provider when you observe these symptoms.
When should you contact a healthcare provider?
It's crucial to contact a healthcare provider as soon as you notice any bleeding during pregnancy. While it might be nothing serious, it could also be a sign of an underlying issue that needs immediate attention. Additionally, if the bleeding is accompanied by other symptoms like pain, cramping, dizziness, or fainting, you should seek medical attention right away. Remember, the color of blood during a miscarriage can indicate whether the blood is fresh or old, but it's not a definitive way to determine whether a miscarriage is occurring or has occurred. The most important thing is to listen to your body and get in touch with your healthcare provider if anything seems unusual. We hope this video has been helpful in understanding what the color of blood might indicate during a miscarriage. Stay safe, and always seek professional medical advice when you have health concerns.